Allergies are very common in the nose area. Our environment has a lot of material in it that people can become sensitive to, and that really is an allergy, an overreaction to something in our environment. When you overreact to that one thing in the environment, what happens in your nose is that you get swell up and you produce secretions, the mucus that ends up in the nose, just like when you have a cold, and that's a reaction to a virus. People who have allergies, though, constantly have this problem when they have a runny nose and swelling and difficulty breathing and mucus dripping down in the back of their throat. Now, the problem that arises from allergies, besides the nuisance of these sensations, is the fact that the sinuses, which are cavities in our nose, next to our nose, that have tiny little openings into our nose, can get blocked too from the swelling. The opening to the sinuses is very small and narrow, and any swelling in the nose can obstruct that opening and cause the mucus that's in the sinus to collect and get infected. But when a patient comes to the office with sinus problems or allergy problems, the first thing, again, that we do is to get them a history to see how extensive is their problem, how long have they been having, or if we can figure out just by talking to them what's leading to the problem. Once we figure out these isolated issues, then we can move on to doing an exam. Then we try to come up with a treatment protocol to treat the allergies and then the sinuses themselves. Allergies are treated mostly by conservative measures first. Air filters, mattress and pillow covers, getting the rooms, the house cleaner in terms of allergy problems. Then moving up to nasal irrigation, nasal washes, and then down to medications in the form of nose sprays and pills. And then if those don't work, then we can get imaging like CAT scan and then move on to a sinus surgery if the need arises. This process usually takes months and months and months and months. Once you've convinced yourself that you've done everything medically to clear out the sinuses, to control the allergies. If those fail, then sinus surgery is what's left to do.